Hi, this is Chris Duncan, independent insurance broker, and today's Medicare video is about Medicare Part D, the prescription drug program. Medicare Part D is a complicated system because it has many different moving parts and different levels, and I'm going to hopefully explain it in an easy to understand fashion. And we'll jump right in, and Part D is provided in conjunction with Medicare and the private insurance companies. It's the private insurance companies that administer the drug program. And Part D, it covers outpatient prescription drugs. And what that means is getting your prescription drugs from the pharmacy. It's important to know that some drugs are actually covered under Part B of Medicare. And remember, Part B is our medical services, also called outpatient. And if you're given a drug in a doctor's office, usually some type of an injectable, it can be covered under Part B of Medicare. An example of this is chemotherapy. You go to the doctor's office and you get your chemotherapy treatment, and then you come home, and that's usually covered under Part B of Medicare. And the reason I mention this is I suggest as a strategy to our clients, if they are getting some type of an injectable drug, to attempt to give it covered under Part B of Medicare. Because if you can get it covered under Part B, then Medicare, original Medicare, is going to cover 80% of that drug. And then if you have a Medicare supplement or a Medigap plan, then your Medigap, in all likelihood, if you have this covered, which almost everybody does in their Medigap, it will cover the balance, the other 20%. So it's a good way to save some money on your injectable drugs. If you want to try and get your injectable drug covered under Part B of Medicare, you are absolutely going to want to talk to your doctor first. See if they've had any success with it. See if they've had some other patients that have been able to have it covered under Part B. Things like your insulin, that's not going to be covered under Part B. We've had a little bit of success of having injectables for rheumatoid arthritis covered under Part B of Medicare. Not a whole heck of a lot of success, but it has saved some of our clients some money to have that covered under Part B. But you're absolutely going to want to check with your doctor and ask them to contact Medicare to see if you'll be able to get that injectable drug covered under Part B instead of Part D of Medicare. To be eligible for Medicare, you must have at least Medicare Part A. Now, I've trained a lot of agents in the past and still do a little bit of training, and there's always a little bit of a misconception amongst other agents that someone needs to have both Medicare Part A and Medicare Part B, both of them, in order to qualify for Medicare Part D. And the way Medicare words this is the beneficiary must have Part A and or Part B. And what that means is if you have Part A, then you can qualify for the drug plans. Or if you just have Part B alone, you can qualify for the Medicare drug plan as well. Or you have Part A and B, also known as Original Medicare. When you have those together, you qualify for the prescription drug program, known as Part D as well. Your Medicare Part D initial enrollment period starts when your Part A of Medicare goes into effect. Sometimes agents get confused where they think you get another initial enrollment period when your Part B goes into effect, but that isn't the case because I've trained hundreds of agents. The reason they think that is Medicare Part B can be put into effect when you lose group health coverage. And then they think because the Part B went into effect, you get a special enrollment period into the Part D. And the reason they get the special enrollment into Part D of Medicare is because they have lost their group health insurance. The initial enrollment period lasts for 7 months, and it is around when your Part A goes into effect. And if your Part A goes into effect September 1st, then you have the months of June, July, and August to enroll into your Medicare Part D for the September 1st effective. And you can also enroll the month of, which is September in this case, and would become effective on October 1st. And then you also have 3 months after your Part A goes into effect to enroll as well. And that would be the months of October, November, and December. And the Part D would become effective the first of the month after you enrolled. For example, if you enrolled into the Medicare Part D, you filled out the paperwork on October 10th, then your Medicare Part D would go into effect November 1st. Remember, your enrollment into Medicare Part A in all likelihood is going to be automatic. And for some people that are drawing a Social Security benefit, their enrollment into Medicare Part D is going to be automatic as well. And the way that you enroll into a Medicare Part D plan is you pick one of the private insurance companies. There's usually about 30 different programs that are available per state. You end up picking one of those 30 programs in your state and simply filling out the paperwork or doing an online enrollment. It's very simple. What is more complicated is picking out the right prescription drug program for yourself. All the different programs have different premiums. Many times they have different deductibles. Almost in every single case, they have different co-payments. And what you're going to want to do is look at each individual prescription drug program to see which one is going to cover all of your drugs, because the prescription drug programs, they don't have to cover all the drugs, but you want to find one that does cover all of your drugs and also at the best costs. And you can do that on your own, or you can use someone like myself to go ahead and help do that research for you. And remember, all of our services are absolutely free. It's very easy for us to check the 30 different programs that are usually available in each state to see how much the costs are on each program. I would like to touch on next what's called the late enrollment penalty for Part D. Most everybody has heard of that. It's one of the biggest questions that we get. How does the penalty work? And we'll cover a little bit more about that later, but I want to tell you that you can avoid this penalty when you have group coverage or VA benefits to avoid the penalty. And you have to have what's called credible coverage, which just means that the prescription drug coverage that you have under your group health benefits is at least as good as Medicare. If you do have group coverage and it covers prescriptions, then you have 63 days from when you lose that group health coverage with the prescription drug coverage in it as well to pick your prescription drug program without incurring a late enrollment penalty. Now we'll move on to the costs of Medicare Part D. And most people, when they begin their research, they're only looking at the premium as the most important factor when choosing their prescription drug program. And it's important to look at all of the costs as a whole. And this includes the premium, the deductible, the initial coverage limits, the coverage gap, also known as the donut hole, and catastrophic coverage as well. And we like to add the pharmacy to look at too, because some programs, they don't cover specific pharmacies. And if you're not taking any prescriptions, then the premium will probably be the biggest deciding factor on your Part D drug choice. And the premium for Part D can range from under $20 to well over $100 per month. When I'm first talking to my clients about Medicare Part D and the premiums, many times I'm asked, Chris, why would I choose a $100 premium plan over a $20 premium plan? And the main reason is because what's called a formulary. And a formulary is just a list of covered drugs. And generally speaking, and this isn't in every case, but generally speaking, the more the premium is for a program, then the richer or the larger the formulary is that covers a bunch of different types of drugs. And also, as a general rule, the lower cost premium plans will usually have low co-payments for generics, and then they'll have higher co-payments for brand name drugs. And those lower premium plans, they are attractive to people who are only taking generic drugs. And the higher premium plans, well, they'll usually have low co-payments for generics, and they'll also have lower co-payments than the lower premium plans for the brand name drugs. I'll give you a quick example. We'll look at a person that is only taking generic drugs, and the copay for the generic is $5, and we'll say that they take 2 generic drugs. Next, we'll say the premium for their prescription drug program is $20 per month. And when you add up the $5 each for the co-payments of the generic drugs, that's obviously $10. And then you put that together with $20 for the premium of the prescription drug program, then this person, for the example, would be spending $30 a month in combination of their prescription drug program premium and their co-payments. Now we'll add a second person to our example. And we'll say this person also takes 2 generic drugs, the exact same as the first one, but they also take 1 brand name drug, as there is no generic available for the brand that they take. And we'll first look at the $20 plan that we described in the first example, and then we'll look at another plan that has a $100 premium to it. And as we know, on the $20 a month plan, the copayment for the generic drugs is $5 each. And in this scenario, we will say the copayment on this $20 a month plan for the brand name drug is $100. And we'll add up the copayments. It's $100 for the brand name drug and then $10 for the 2 generic drugs. That totals $110. And then when we add in the $20 premium, that makes the monthly total $130. Now we'll look at an example of a prescription drug program that costs $100 a month. And we'll look at the drugs for the 2 generic drugs and the 1 brand name drug in this example. And we'll say the copayment for the brand name drug on this $100 a month premium plan is $25. And then the copayment for the generic drugs is $0. So when you add those together, the monthly copayments for those 3 drugs would obviously be $25. And then when you add that together with the $100 premium, the total cost per month with the premium and the copayments for the drugs is $125. And that would be $5 less than the program that has the $20 a month premium and the $5 copayment for each generic drug, and then the $100 copayment for the brand name drug. All Part D plans have what is called tiers on their formulary. And all Part D plans have different tiers. Most plans have a 5-tier system. There are some that are 6, but we'll talk about the 5-tier plan as that's over 90% of the plans. And the first tier is usually for what's called preferred generic drugs. And preferred just means a discount that the prescription drug program has worked out with the pharmacies to lower the costs. And then tier 2 are for your regular generics. Tier 3 is for preferred brands. Again, the insurance company has worked out a discount for these preferred brand drugs. Tier 4 is for regular brand drugs, and Tier 5 is for specialty drugs, usually injectables. The different companies and different plans, they all have different costs on the tiers. One company might have a $40 copayment for a Tier 3 preferred brand name drug, while another company might have a $20 copayment on their Tier 3 preferred brand name drugs. Also, the companies have formularies, like I mentioned, which is a list of covered prescriptions. And one company may have a prescription on Tier 1, while the other company might have it on Tier 2. It all depends. And also, one company may cover a particular prescription, and another company may not cover it all. That is why it's important to do your research for all of the Part D plans. I get many referrals for Part D prescription drug plans. Usually what ends up happening is my client is talking to their friend or neighbor, and they bring up a fact where they're paying an extreme amount of money for one of their prescriptions, let's say $200, and as they're talking to them, they ask them, well, how much does your prescription drug program pay? And they say, well, it doesn't pay anything. It's not covered. And they say, well, maybe you need to talk to Chris really quick because he looks at all the different Part D plans. And then they usually call me, and as I'm talking to them, I ask them, well, how did you originally pick that first plan? And usually what they tell me is they picked a plan that was from the insurance company where their group health insurance was. When they lost it, they had XYZ company, and they just picked the plan from XYZ company with the best premium and didn't look to see if all of their drugs were covered. And at that time, I tell them, well, there may be a company that is out there that covers it. And I do the research, and we look at all the companies, and maybe we can help and maybe we can't. But at least we know that we've looked at all the programs. And most of the time, what ends up happening is we find a company that will cover it and will save that person quite a bit of money. Now we'll talk about the different levels of coverage for the Part D plans. And they start with the deductible, the initial coverage level, the coverage gap, which is also known as the donut hole, and catastrophic coverage. First, we'll talk about the deductible. And the maximum deductible in 2020 is going to be $435. And I'm asked, well, if plans don't have a deductible, why would I pick a plan with a deductible? And usually speaking, the plans that do have a deductible built in do cost lower monthly premiums. And even if you do take a couple of generic prescriptions, the overall cost throughout the year would be less expensive for you to pay full cost for the generic and the premium than it would be to get a program that does not have a deductible and also has a higher monthly premium. The second phase of coverage is called the initial coverage level. And you reach this when you've satisfied your deductible Or if you happen to have a plan that doesn't have a deductible, then you go directly into this phase, into the second phase. And the initial coverage level for 2020 is $4,020. This is the amount that you and the insurance company will pay during this level or phase of coverage before you move into the third phase, which is the coverage gap, also known as the donut hole. And to give an example of how this works, the combined amount for what you pay in copayments and what the insurance pays the pharmacy for a prescription is what goes towards this $4,020. So we'll use an example of you get a prescription, you have a $10 copayment, and the insurance company pays the pharmacy $90. So when you combine both of those payments, that comes out obviously to $100. So after that prescription, you now have $3,920 left in the initial coverage period. And then this keeps going lower and lower with each prescription that you fill until you run out of that $4,020 and you move on to the next phase of coverage, which is called the coverage gap. This is where the Medicare beneficiary usually has the least amount of help for paying for prescriptions. If the Medicare beneficiary reaches this phase, it is extremely critical to closely look at all the plans. And Medicare dictates the most a Medicare beneficiary can pay for generics during the coverage gap, also known as the donut hole, is 25%. Medicare, they pick up the other 75% for the generic drugs. Now, some companies may have additional coverage in the coverage gap. For example, a company may have full coverage for generics in the coverage gap, which means that they pay the same price for their generic drugs in the coverage gap as if they would during the initial coverage level. In regards to brand name drugs in 2020, there is more coverage in the coverage gap for brand name drugs. The Medicare beneficiary was responsible to pay 25% of the negotiated price for the brand name drug. The manufacturer of the brand name drug, they're responsible to pay 70%, and Medicare is going to pay the other 5%. So like we said, 25% is paid by the Medicare beneficiary, and 75% of the cost of the brand name drug during the coverage gap, also known as the donut hole, is picked up by the drug manufacturer and Medicare. To move out of the coverage gap, then there's what's called a true out-of-pocket cost. And this cost in 2020 is $6,350. When you've paid a total of $6,350 out of your pocket for your prescriptions, that doesn't include the premium, then you will move on to the next phase, which is called catastrophic coverage. The catastrophic phase is the easiest to understand, although it is still a little bit complicated. But if you're taking a generic drug and the full cost of the generic drug is $72 or less, then the copayment for that drug is $3.60. And if the cost of the generic drug is over $72, then the cost to you, the Medicare beneficiary, is going to be 5%. And the cost for the brand name drugs, if the full price of the brand name drug is $179 or less, then the copayment to the Medicare beneficiary is $8.90. And if the full cost of the brand name drug is over $179, then the cost to the Medicare beneficiary is 5%. If you do reach the catastrophic phase, this is, like I said, the last phase, and you will remain here for the rest of the calendar year. Starting on January 1st, everything is going to start all over again. Now, we do see some clients who actually have high costs, usually for prescriptions for multiple sclerosis and rheumatoid arthritis, that can reach this catastrophic phase rather quickly. We have a few that reach this catastrophic phase in less than 2 months. Next on my list to talk about is the late enrollment penalty. And when a Medicare beneficiary enrolls into Medicare Part D and they don't have any outside credible coverage through their group, or they don't have any VA benefits, then they are assessed what's called a late enrollment penalty, and usually that penalty lasts throughout their lifetime. And the definition of the penalty is 1% of the national average premium of all Part D plans offered for every month you are not enrolled when you first become eligible. The penalty is applied monthly, Now this sounds complicated, but once you plug in the numbers, the formula is pretty easy to understand. We're going to now look at an example to figure out the late enrollment penalty, and we're going to use the 2019 national average premiums because as of this recording, the national average premiums for 2020 have not been put out. But in 2019, the first thing to know for this example is the national average for monthly premium of all prescription drug programs is $33.19. And now we'll talk about a Medicare beneficiary who was first eligible for Medicare Part D in June of 2015, and they went without coverage all the way through, in our example, through December of 2019. So they're putting their prescription drug program in place in January 1st of 2020. And that's a total of 55 months. So there is going to be a 55% penalty. And the way you figure that out is you take the national average premium, in this case of $33.19, and we multiply that simply by 55%. And that total is $18.25. Now Medicare, they round this to the nearest dime. So that total is going to be $18.30 in this example. So if you get a Medicare Part D program, that is $100. And when you add in the penalty, your total monthly premium for this plan is going to be $118.30. And if you happen to get one that's $20 for the monthly premium, then your monthly premium with the penalty is going to be $38.30. It's also important to know that this penalty, it goes up and down every year because it gets rebased on the national average premium for the current year. And they go up and down a little bit every year. Next to talk about is the annual election period. And this is the time of year, once a year, when you can add a Part D prescription drug program or you can change a prescription drug program. This is at the end of the year. This is when all the commercials are going on about Medicare. And that lasts from October 15th through December 7th. And any change that you make during this time goes into effect January 1st. And this is what you can do during the AEP. If you do not have a drug plan and you missed your initial election period, this is the one time during the year that you can go ahead and get into a Part D plan. So let's say on November 15th, you've gone ahead and signed up for a Part D program, and then that's going to become effective on January 1st. Because you missed the IEP, if you didn't have any type of credible coverage through your group, or you didn't have any coverage through VA benefits, then you're likely to be assessed the penalty that we previously talked about. This is also the time of year when you can drop your prescription drug coverage. Let's say you have prescription drug coverage and you no longer want it for whatever reason. Then you can contact your prescription drug company and say, hey, please disenroll me, and they will disenroll you effective January 1st. Now, if you want to get into a drug program later, you're going to have to wait the whole year until the next annual enrollment period if you go ahead and drop that. You can't come in and out of the prescription drug programs. This is also the time of year where you can change your prescription drug program. Let's say you got a letter from your current prescription drug program and it said one of the prescriptions that you take is no longer covered under that program. Then this is your once a year time that you can make a change into your prescription drug program. And this is also the same time that you can make a change into Medicare Advantage. That's a separate video, and you can find that here on my website. It's also important to know, I get a lot of these phone calls during the annual election period, people saying, okay, I want to change my Medicare supplement. The Medicare supplements have nothing to do with the annual enrollment period whatsoever. A lot of people think this is when they can change their company of the Medicare supplement without any underwriting or answering any health questions. That is 100% absolutely not the case. The annual enrollment period has nothing to do with Medicare supplements. It only has to do with prescription drug plans and also Medicare Advantage plans. This covers the basics of Medicare Part D and a little more. Again, my name is Chris Duncan, and I am a licensed independent insurance broker, and I try to present this information in an easy to understand format. And what I do is I help people with their Medicare choices because, as we know, Medicare doesn't pay 100% of the bill. So if I can be of service to you, helping you with your Medicare supplements, your prescription drug plan, or your Medicare Advantage choices, please feel free to call me. Our phone number is 800-910-3382. And if you liked the information in this video, please hit the subscribe button in the bottom right-hand corner as we're continually putting out new videos with additional information. And please leave any comments below as well. Again, thank you very much for your time, and we'll be talking with you soon.